If you've ever tried to lose weight, you know what works for someone else may not work for you. Overlake Medical Center is here now with how their services can help find solutions that are right for you, specifically you. Joining me now is their bariatric surgeon, Dr. Thien Nguyen. Thank you so much for being here on New Day.
Thanks for having me.
This is something that I think so many of us have become frustrated with in our lives, trying to find that right solution for us. So tell us what the weight loss services program at Overlake Medical Center does.
Yeah, so we provide comprehensive options for patients who are needing to lose weight, whether it's through non-surgical medical options, counseling, dietitian, and then also medications, and then also, of course, surgery.
Right, because I think everyone realizes it's not always surgery that can help. There's so many other factors. My doctor talks to me a lot about BMI and the health risks that require, some more attention and maybe some weight loss. Let's talk about that. What factors kind of play into when we need to really be focusing on weight loss?
Sure, yeah, so we start with BMI. That's kind of a rough estimate of someone's obesity illness. It's means body mass index. It's a ratio of someone's weight to their height. And that kind of gives us a starting point to whether or not they should consider medications or surgery. And then, of course, we look at a person's health and the effects of their obesity, whether they have diabetes or high blood pressure or sleep apnea. So that's how we start the process.
Okay, so once you start, you get a look at that. And it's important for a doctor to do this, right? I went to a gym once and they put me on there and tried to tell me, and I thought, this seems weird. It is important to have a medical staff kind of guiding you through what your body is saying, right? Absolutely,
especially when someone has a lot of weight to lose and they're starting to become ill, they may have limitations on their exercise, or they need to have medications and so forth. So yeah, it's definitely a major medical problem.
So let's talk more about this. Who is a good candidate for weight loss surgery, and then who is not?
Yep. So we start out with someone whose BMI, body mass index, is 40 or more. Or if they're not as heavy, it may be a BMI of 35 to 40 plus other medical conditions like diabetes. And then, they're motivated, they've tried other options, they're willing to follow a program, and those are some potential candidates. And then obviously the opposite, patients who aren't ready, who need some more fine-tuning, I guess, getting medically ready. And then, there may be some issues of, depression or smoking and so forth. So we try to get those things as good as possible.
You want the person to be healthy and whole before going into a surgery. And then there's support afterwards, right?
Oh, yeah. So, we used to just do surgery and hope for the best. And, what we find is that, patients can gain some weight back. And so long term, it's really important to also continue the follow-up to, look for complications, but also to help encourage folks and give them options if they regain some weight back. And
when you were talking about BMIs up in the area of 30, I think a lot of us were like, oh, we've heard something like that. I wanted to ask you, what type of surgeries are performed at Overlake, and how does someone know what is the best option for us?
Sure, we do minimally invasive surgeries. We use little incisions. We use the Da Vinci robot, and we offer Roux-en-Y gastric bypass. We do sleeve gastrectomies, and then we also do revisional surgeries if someone's had a band or other complications and so forth.
Well, that's good to know, because that's happened, right? We've seen this happen, and
yeah. It's it's a whole spectrum of things that often needs to be done.
So walk us through a first appointment when they come into your center. How does that go? I mean, maybe someone's nervous to head in. What does it look like when you walk in?
Yeah, so our staff is very experienced, and they're very caring, and they've been doing it for a long time, so they can literally just walk the person through the whole process, get them the insurance question, they meet with our nurse practitioner or myself. We get a really long, detailed history, spend about an hour or so talking to the patient. And then, there's going to be a plan, there's going to be a checklist, there's going to be multiple visits with, our dietitian and our mental health evaluations and blood work and, imaging and so forth. And then, again, they spend a lot of time with me right before surgery as well, just to really choose the surgery and answer the questions.
It really sounds like you are caring for the whole human, which I think is so important. How can people find out more?
Yeah, it's Overlake Medical Center, and we have a weight loss center and service there. Just go online.
Awesome. Dr. Nguyen, thank you so much for taking us through this and sharing more information about something that we may have all heard about but not really known enough. So we appreciate that.
My pleasure.
All right, to learn more about what we discussed today, be sure to visit Overlake Medical Center's website, which is right there on your screen. You can go directly to the weight loss department by following that link, and we've got that link on New Day's website as well.